Right. Uh, right. Right. Kapiging.
Right, right, right. In the last 24 hours, Zambia.
Testing microphone 1 2. Are you able to hear me? You Wamake Joe at Happy Mother's Day. All right, then good. But put it on air when the minister comes. Yeah.
Good morning, countrymen and women, and good morning, members of the press. I recognize the presence of my colleagues in the ministry. My team here is the two permanent secretaries and the permanent secretary from the Ministry of Information. And I do recognize the town clerk of the Lusaka City Council, a key stakeholder in public health. Further, I recognize the presence of our technical lead in case management, Dr. Makupe, and Professor Lloyd Mlenga seated up here with me, and my colleagues from the profession, the Director of Public Health, Dr. Silomesi, Head of Laboratory Services, Dr. Shubemba, and all senior colleagues. The Health Professionals Council of Zambia is with me today, and I recognize the Registrar of the Health Professionals Council of Zambia. The partners that have come to work with us, you're welcome to today's daily briefing. The Republican President, His Excellency Dr. Edgar Chagwa-Lungu, continues to oversee with a watchful and analytical lens the COVID-19 response in Zambia. President Lungu has been overseeing the response and has been executing an adjustable, scalable, adaptable plan to COVID-19, and this is informed by the daily evolution of the pandemic. And reflecting the core value of transparency that he embraces, he has charged the Minister of Health with the responsibility to update the nation on a daily basis on the state of the pandemic. The COVID-19 virus has a propensity to spread very rapidly. It is also unpredictable, and this justifies the adjustable, scalable, and adaptable plan that President Lungu has been overseeing in the country. And on a daily basis, he does review the data and with his technical team provides guidance on what should follow. Yesterday, the nation was alarmed with the figures in Nakonde, and today, His Excellency President Edgar Chagwa-Lungu has directed measures to respond to the data that got out of Nakonde and to the state of the pandemic in the country as informed by what we got out of Nakonde. To this effect, the situation in Nakonde remains grave and the President is concerned, and in this regard he has directed as follows: that with effect from Monday, the 11th of May 2020, the Nakonde border will be temporarily closed. There shall be no traffic in and out through the Nakonde border. Further, there shall be no traffic in or out of Nakonde to facilitate the implementation of targeted interventions that include training and retraining of our port staff, including immigration, ZRA health staff, so that we could actually assure that they are ready to deal with any immigration and migration and any movements, of goods and services without endangering their lives. This will also be accompanied with other measures such as redeployment or deployment of more staff into the area, and secondly, reinforcement of personal protective equipment and other medical supplies in the area, rearrangement of quarantine facilities, and ensuring that business returns to normal as soon as possible when all those measures are put in place without putting the people of Nakonde or the staff at risk. We have mobilized adequate personal protective equipment and medical consumables and multi-sectoral teams. In the true spirit of a whole government approach, as guided by His Excellency President Lungu, the Ministries of Health, Home Affairs, Commerce and Trade, and Transport will collaborate to ensure that there is a collaborative and coherent effort to ensure that Nakonde is streamlined so that when we resume activities at the border, when we resume activities within Nakonde, it is not going to put the staff or the community at risk. The multi-sectoral teams continue to comb the area in Nakonde, and as we speak today, various samples have been collected from various stakeholders in the community. We are continuing to process those samples, and we are continuing to validate the results. And today, we will focus on continuous processing of the samples and validation of the results of the samples, and we will give a comprehensive summary of the screening and testing in Nakonde in our update tomorrow. So we will focus on Lusaka as we talk about figures, and will allow our technical colleagues to continue with the processing of the samples and validation, and we'll give a consolidated figure in our update tomorrow. But to show his grave concern to the situation in Nakonde, the President has directed as such that there shall be no traffic in and out of Nakonde, and there shall be no movement in through Nakonde border, commencing tomorrow, to accommodate the multi-sectoral teams and the whole government approach to take effect to ensure that we make trade and commerce safe. Remember, the aspiration of the President is to allow the economy to run without allowing a public health crisis. This is the reason why the adaptable plan, the scalable plan, will have measures that will respond to the daily evolution of the pandemic. As we talk about Lusaka, we tested a total of 250 samples in the last 24 hours, and out of these, 15 cases were COVID positive. And out of these 15 cases, 14 are in Lusaka district and 1 in Chilanga. The positive cases include 1 alert from the community, 2 contacts to known cases, 3 persons with a history of international travel currently under quarantine, 5 routine testing, and this brings the total number of COVID cases in Zambia to 267. 5 patients have tested negative consecutively on 2 days and have been discharged. Therefore brings the total number of recoveries to 170. All the patients in our COVID-19 isolation facilities are in stable condition. And therefore, our figures today cumulatively reflect 267 total cases with 7 deaths, 117 recoveries, and the rest of the patients that are within our care, very stable. Now, we continue to monitor those persons at high risk and those that are notified through alerts. And amongst those that we've been monitoring and placed on the 14-day quarantine period, 3,684 have successfully completed the 14-day quarantine period and have been discharged. In addition to that, 1,851 cases have been cleared as non-cases out of the alerts that we get from the community. Globally, we have now crossed 4,100,000 mark, with 4,100,001 cases, including 280,454 deaths. Recoveries stand at 1,442,985. Africa, in the last 24 hours, recorded 2,826 new cases, and the death toll stands at 2,232. 21,649 cases have been reported as recoveries in 55 countries and territories. Members of the press, fellow countrymen and women, targeted screening, mass screening and targeted testing is one of the key strategies that we use to quickly detect active cases and enable us to understand the epidemiology, to enable us refocus our strategies appropriately. We therefore be performing similar operations in Nakonde, in Katima Mulilo, Kasumbalesa, and other border areas, including other districts that are highly suspicious. The provincial ministers heed the call from His Excellency President Lungu in his address to the nation to provide leadership in their jurisdictions to ensure that surveillance was heightened in their provinces, in each district, and ensure that any little flames are quickly extinguished before they become raging fires. Your continued adherence as a community to the guidelines that are provided in the presidential address and informed with the Public Health Act and Statutory Instruments 21 and 22 is critical to the response. Allow me to reiterate that gatherings, public gatherings, are restricted, and they can only be certified subject to regulations and guidelines in the Public Health Act and Statutory Instrument 21 and 22, and as guided by His Excellency President Edgar Chagolungu. Let us continue to practice, to exercise high levels of personal hygiene and environmental hygiene. And let us ensure we always wear masks in public. Wearing of appropriate PPEs by health and other multi-sectoral team members is fundamental as you carry out your work. Notification of suspected cases is going to continue, and alerts from the public remain critical to the response. Community surveillance is key. Hospital or facility-based surveillance will continue for us to ensure that we understand the extent of the epidemic. Practicing physical distancing is extremely important. And be reminded that handshaking is not allowed in this dispensation. Hugs are not allowed either in this dispensation. However much you are in love, we're not allowing hugs. May I conclude by wishing our dear mothers a happy Women's Day and emphasize that together we can win this fight. And with the mothers in the lead, ensuring that we all stay home and practice as guided by His Excellency President Edgar Chagolungu, we shall win this fight. So our mothers, we appreciate you and wish you a happy Mother's Day. May God bless Zambia and good health, with good health and prosperity. Thank you.
That was the address on the COVID situation in the country by the Honorable Minister of Health, Dr. Ashwaga Shuta, today, the 10th of May 2020. We will now proceed to give an opportunity to the members of the press here present
was Kawe Mayor was saying is a 18-year-old male with no travel history, and also a 33-year-old female, a health worker at Kawe Central Hospital. The mayor also went ahead to announce 2 positive cases of COVID-19 from Kapiri. Honorable, are these people supposed to be announcing COVID-19 cases? If they are not supposed to, then why are they trying to do a job? Thank you.
My name is Darius Jordan from Diamond TV, and let's have 2 questions for you, Honorable. And my first question is just to seek clarity on the 24-hour testing period. I would like you to guide us when this is. I'm asking this question because on Friday we saw President addressing the nation, where he disclosed that the country had recorded 14 cases in the last 24 hours. And a day after that, you announced 85 cases of COVID-19. And in line with this very question, we want to find out, when did you know about the 85 cases? Was it before or after the presidential address? And still on this very question, Honorable, is it true also that you might have maybe misled or ill-advised the president to open certain sectors of the economy, knowing very well what is happening in our economy? Thank you.
Ipshen. Yes, you done.
My concern is on the commercial sex workers from Nakonde. How is the contact tracing, considering that Nakonde is a transit area, and most of those who have conducted business with those commercial sex workers might have moved to other parts of the country. So how strict are you on contact tracing with regards to commercial sex workers? Because my colleagues are concerned.
Honorable Minister, we will request you to respond to those questions.
Right. Well, thank you very much. I emphasized from the word go, I emphasized from my preamble that His Excellency President Edgar Chagwa Lungu has been overseeing a multi-sectoral, adaptable plan to COVID-19 that is informed by the daily evolution of the pandemic, the data and the evidence adduced. Therefore, this plan is scalable, upwards, adjustable, downwards. Science informs the president's decisions. And therefore, the epidemic can rapidly evolve. The epidemic, remember, is driven by a virus with a very high propensity to just spread in a very unpredictable manner. And so, all these measures, the epidemiology around it, inform the decisions that His Excellency President Lungu makes on a daily basis as he watchfully monitors the pandemic. So I want to assure you that for us in the Patriotic Front government, under the presidency of Dr. Edgar Chagolungu, one value we embrace is transparency. So we have no business hiding figures, because hiding figures does not add value to the control. We have no business hiding data. This is the reason why the president has insisted that on a daily basis, update the nation and feed them with the data. And the data that we feed to the nation is the basis upon which His Excellency President Lungu provides leadership in adjusting the scalable and adaptable response plan. The plan is multi-sectoral. The plan from inception screams loud, there shall be collaborative effort across sectors. And this is what we've been doing. I'm joined here by a senior colleague in Cabinet, the Minister of Home Affairs, Honorable Kampiongo. Welcome.
Thank you so much, Doc, and good afternoon to our colleagues from the media and to our people out there.
Even as the President directs a temporal suspension of activities at the border, the instruction is clear to the Minister of Home Affairs, Minister of Health, Minister of Trade and Commerce, Minister of Transport and Communication, and indeed all other stakeholders. So it is a multi-sectoral response, and I must emphasize that the plan is adjustable, it's adaptable, and is informed by the daily evolution of the data. And this he has made very clear. The President has been consistent in his address to the nation, stating any measures that he put in place would be subject to two things: the Public Health Act, statutory provisions, and the evolution of the pandemic. That is clear. So I don't think that should be a matter of debate. Commercial sex workers have been very cooperative in our investigations, and they've given us all the leads that we need. And we had a case where one of them appeared, with symptoms, and told us about the client, who was a truck driver from a foreign jurisdiction, even gave us the number, and we called that truck driver. And the one who answered told us from that jurisdiction that the one we are calling is actually sick and is on O2 in the hospital. He has COVID, and that gave us a lead. So they have been cooperative in our investigations, and we do not want to stigmatize or discriminate against them as we investigate. And they've been very useful in contact tracing. Now, Sinkala is not here, one of my senior health promotion officers, but watch his video where he's saying, we are revealing everything because of COVID, because we'll ask you which lodge you went to, who you spoke to, what time, and all the information is coming out. So he's saying this COVID is a very bad disease because of those connotations. Now, humorous as he puts it, but what he's trying to emphasize is that the contact tracing is robust. And it is in your interest and in our interest and in public interest for us to know everywhere where you have been. If that be a deterrent from you not visiting certain places and not interacting with certain individuals, then that's a positive consequence. When did we know about the 85 cases? When we announced them. We don't hide any data. We are current. For instance, we've told you today that we are still processing the samples and doing validation, and whatever results we have today and what we'll have tomorrow put together is what we'll announce tomorrow. But we don't want to give you patchy results or unvalidated results. So we want to be very, very straight with the public. We've got obligations to the public locally and to the international institutions that we are accredited to. So we are mandated to report to our international partners and ensure that the information informs both in-country and our regional responses. And remember, we have been summoned to the utmost of responsibility as the anchor for the Africa Center for Disease Control. So good practice is our inescapable responsibility. So the President is informed of every detail, and all the data and directives that are given during our addresses are based on the information the President gets on a daily basis. Like I said, with a watchful and analytical eye, he watches the COVID-19 epidemic. City mayors and any other authorities are allowed to repeat what the President has announced or what the updates are in these updates. Anything outside that is irregular.
Thank you very much, Honorable Minister. We will go for another round of questions. Do we have any other questions? Please come.
The minister did not answer my first two questions in terms of the time frame and why it is taking long to close the border.
Honorable Minister, you may wish to respond to the question on the time frame for the Nakonde mass screening as well as the time it has taken to close the border at Nakonde.
That's Darius. McPherson. McPherson. Ninja. I said, there is nothing like we've taken long, because it is informed by the daily evolution of the pandemic and the evidence that is on the table. And remember that this is a delicate balance between allowing the economy to run and averting a public health crisis. So we recognize that border as the major entry and exit point for key economic activities that Zambia's economy anchors on. And therefore, we will be very cautious in dealing with cross-border collaboration, with cross-border partners. So the decision is informed by the data that came. I'm sure it was for the very first time that you heard those figures yesterday. Yeah, so the decision is time. And how long will be informed by how ready we are going to be, how soon we're going to be ready to ensure that we have retrained and trained staff at the ports of entry, to ensure that we don't put our staff at risk as they deal with immigration and migration. We also need to ensure that we determine the extent of the challenge in Nakonde and ensure that we put in measures to stop the community spread. So Nakonde, apart from no traffic in and no traffic out, there is a stay-home advisory so that we can thoroughly clean up Nakonde, disinfect public places, ensure that business is being conducted in a safe environment. Thank you very much. But let me reassure you that this will be surgical, swift, because as you already heard, the President is very sensitive to the need to balance economic activities and public health.
Thank you very much, Honorable Minister. We will go for our last round of questions. Please come.
However, still feel guidance has not been given on my first question as regards to the 24 hours testing. From when is this 24 hours? The question I've asked, maybe you can clarify on that. And then I know we have imposed these measures in Nakonde. There is unverified information
Darius, is it Chumunia? Darius. Darius, 24 hours means 24 hours. 24 hours means from 6 today to 6 the following day. This is the reason you misunderstand 14 days. 24 hours means 6 today to 6 tomorrow. Okay, let's start at 8 today. It's also up to 8 tomorrow. Do you want us to give more examples from 10 today to 10 tomorrow? That's 24 hours. Yeah, so sometimes we begin at 03 sometimes and end at 03 the following day. We always have a cutoff point. Yeah. So, secondly, I made it abundantly clear. We don't have any information to hide. And we will tell you when we do a cutoff. You can call us at 17 hours today. We'll tell you the number of positives. But we have a cutoff point because we must be orderly in the way we report. So we will not entertain confusion by starting to announce patchy results or results that are not yet concluded. Remember that you can tell us the number of results, the number of samples tested now, but we have not yet validated. There are quality control processes, validation that takes place. So at 16 hours, this may be the number. By the time we clock 24 hours, the number will be different because of validation issues and so on and so forth. And so we want to assure the public that yes, there are a number of cases that we've already picked out in Nakonde that we are validating, and we want to give it as a complete figure. So by press time, we do not have a complete figure. And so the assurance is we will not withhold any information. And we are being sincere when we tell you that we are continuing to process the samples from Nakonde, and when we finish the processing and the validation, we will announce as a block figure tomorrow. We are on record to have said numbers will surge. We are on record to have said we're in the surge phase. We are on record to have said we are far from peaking. We are on record to have said what is obtaining in our region will also affect the pandemic in country. So we know where the challenges are, we know where the problems are, but we will not be derailed. We are monitoring the pandemic with a watchful and analytical eye, and we will inform the public transparently. And the media should join us in ensuring that we have validated and confirmed data to the public. And we want to assure you that we have no business or interest meddling with numbers or figures. And if we tell you that we are still processing 800 samples, we don't want to give you results for 100 samples or for 400 samples. We want to give you results for 800 samples because that's what we believe in. So our cutoff point for Nakonde will be later on in the day, and we'll be able to announce the results as a complete block without any manipulation. So I frown at the insinuation that we're hiding figures. That does not reflect who we are, and it's not part of our values, and we find no business, no value in that, as we know that hiding figures will result in misinforming the public and misdirecting attention, and may result in deaths. So that's not who we are.
Honorable Ministers, the permanent secretaries, members of the press, we continue to receive goodwill from various partners across the country, and today we are delighted to receive a donation from the Bank of Zambia retirees.
current date, these retirees, after realizing the plight of the needy in society, in terms of some requirements to try and counter the coronavirus disease, decided to say, let us play a part to help the needy. What do we do? The lady, Mrs. Nduwe here, was asked to coordinate the activity of trying to raise money from the retirees in order to make some masks, face masks, and some sanitizers to help those people we know need that sort of help. Honorable Minister, I'm glad to inform you that with the effort made by the retirees, we raised an amount of about 5,000 kwacha. And that translates in terms of about 600 face masks, which we would like to hand to you today, and 9 sanitizers. Since we know that, Honorable Minister, the people who require these masks, those needed people, we didn't know, we don't know. We are also retirees, so we don't know who, but I believe that the ministry knows the type of people that require. So we'll hand it over to you so that you can please help to hand it over to those people that can benefit from our project. Thank you very much.
We want to thank the retirees from Bank of Zambia for this generosity towards the cause fighting against COVID-19. You are showing that you are our parents and you really care for the generations. This should be a benchmark for all to follow. We thank you for partnering with President Lu's government in the fight against COVID. Mr. Puri, we told you clearly that we should give these masks to the people that need them, and we will do just that. I know for sanitizers, you failed to pronounce it. You said sanitizers. But yeah, we understand. English was not an easy promise. So he is careful to say these, but this case. So we thank you so much, and we're very proud and humbled, by this generosity. Every Zambian would actually take the way our parents, the retirees from Bank of Zambia, are thinking today. COVID-19 could be confined to the past. We thank you for your leadership. We are encouraged. Thank you so much.
Well, thank you indeed, ex-employees of the Bank of Zambia. Honorable Minister, I will now request you to provide your concluding remarks as we come to the close of this hearing.
Well, thank you very much. And before I conclude, remember that we have said repeatedly that His Excellency President Lungu is overseeing a multi-sectoral response to COVID-19. Collaborative efforts across government sectors is key. As you know, COVID-19 is first a public health emergency that has disruptive effects on education, on other sectors of the economy, and also summons many other sectors to the table as we respond. So Home Affairs have been a key stakeholder in the COVID-19 response. They've participated in provision of security to staff as they carry out measures. They've been involved in movement of essential goods, and they are just one very significant partner and ally that we have worked with together. So the Ministry of Home Affairs, as we speak about the presidential directive to close temporarily the border, will be a critical ally in all this. So I now have the pleasure to invite my senior colleague from Cabinet, Honorable Kampiongo, to deliver his remarks. Yeah, it's on.
Thank you so much, Honorable Minister. And let me recognize the presence of permanent secretaries and the senior medical personnel that have been with the minister as he has been updating the nation. Good afternoon, our colleagues from the media and our members of the public out there who are following this update. I want to say from the onset that on behalf of His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwalungu, and the Minister of Home Affairs, and indeed on my own behalf, I would like to send our sympathies to those of our security personnel and their families, and I mean those security personnel that have fallen victims to this pandemic. And I want to, at the same time, applaud them for their courage, for their bravery, as they have been saving their nation during this very difficult time. And I know that they are still committed and able to save their nation in terms of going forward. And so I also want to appreciate the Honorable Minister of Health and his team, who have assured me that now they make sure that the protective wear that those of our officers will be manning the border posts will be changed in order to ensure that their protection is guaranteed. You may wish to know that at the border point, we have different law enforcement agents. Apart from the Immigration Department, we have the Zambia Police Service. We also do have Drug Enforcement Commission, and as you know, the Zambia Revenue Authority. All these work in the same environment. And so tomorrow, we hope to come and give the actual numbers of those of our officers that could have been affected, and what we intend to do in terms of going forward with the deployments that we are going to put to take place for those of our officers who will have to be in the medical facilities for medical attention. Now, the measures that the President has pronounced with regards to how we manage the Nakonde border facility are very key and very important. Why? Because when Nakonde is affected, you certainly expect that to trickle down if we don't manage and act swiftly in preventing the spread of the virus. We expect a trickle-down effect for all those towns and districts that are along the Great North Road. Isoka, Chinsali, Shuangandu, Mpika, all the way to Serenje, Mukushi, and Kapirimposhi, and basically go to the other parts of the country, be it Lusaka or Copperbelt. So it is important that we get to deal with this matter within Nakonde, and I'm happy that the minister has introduced a facility in Chinsali where the medical services will be offered to the victims, and also where the testing will be done so that results can be given in good time. So we are going to deploy additional numbers of law enforcement. And I think the Commissioner of Police for Muchinga Province, who is required to be supplemented by the efforts of the Inspector General of Police from here in Lusaka, are now preparing on how we are going to ensure that the measures that we impose as the medical personnel going to continue the massive testing are adhered to. And that will include restricted movement of the people. Because you know, those of you who have been to Nakonde, or those of you who know how Nakonde operates, our people from both sides of the border interact on a daily basis, commercially and socially. So we have to make sure that the measures that we're going to put in place will be to make clear to our people that they will have to stay in homes. And so it's important that they start preparing now, that in the few days, as the minister has announced, they will have to be at homes, so that we know how much of this problem is in the communities of Nakonde and beyond. And this will also entail that from Nakonde, Isoka, we shall put measures that will be to ensure that those that use the illegitimate entry points are also tracked on the way. So Isoka, Chinsali, Shwangandu, Mpika, we are going to intensify the check points. And so it's very important that those who intend to move are made aware of these measures that we are going to put in place. But we would like to appeal to our people now, those that intended to travel to Nakonde, to rethink their position, because you can't be going to an area which has already been declared an epicenter for this coronavirus. And the bus owners and those that are in the transport sector also are discouraged from making trips to and from Nakonde. And I think when the Minister responsible for Mchinga Province, Honorable Sichone, his PS and the medical team went to start the screening in Nakonde, it was made clear that out of the results that were going to be given after the testings, after the correction of the samples, we were going to determine the measures that we are going to put in place. And I think the President has made a timely decision to try and control and restrict the movement of the people to and from Nakonde. I know that people have been, speculating as to say the number has gone up just after the President has pronounced some measures. You must understand that he was even very clear to say these measures were going to still be within the already pronounced measures, especially when it comes to the schools, where he has allowed the examination classes to resume classes. It to still be done observing the same measures that the Honorable Minister of Health has been speaking to us about from the time we started dealing with this COVID-19 pandemic. So there's nothing like why the number up after the President has pronounced. We'll still need to live. We'll still need to live as citizens, and we'll still need to allow certain activities to be done while it's observing the measures that the Minister of Health and the health staff are giving to our citizens. So in a nutshell, we are going to collaborate, and I think after this briefing, I just arrived from Mchinga myself. Was in the constituency where I was sensitizing our members of the public, knowing that Shwangandu is is part of the transit route of the Great North Road. And so we are going to sit down and put measures in place so that tomorrow we'll be preparing our men and women in uniform to be on the ground. But as you know, I've always said, they form part of the front line, and therefore they need to be supported as they are serving their nation and exposing themselves also to this same danger everybody is exposed to. So, Honorable Minister, we stand together, and I'll stand with my personnel, security personnel who are in the front line, of protecting the territorial boundaries of this great nation, Zambia.
Thank you very much. Honorable Minister, thank you very much for those very strong words of counsel to the public and also guidance to relevant officers. As we close, we would like to re-emphasize that we are seeing increasing local transmission in our various jurisdictions. So it is important for us to participate in stopping that community spread. And how do we do this? Stay home. How do we do this? Wash your hands. Make sure that the environment is clean and devoid of any particles where the COVID-19 could settle. And let us ensure that we postpone travel. Yesterday, I did declare, and I repeat, that Nakonde is an infected area. Nakonde is an infected area, and it's declared so as provided for in the Public Health Act. Therefore, do not travel to Nakonde. And today the President has guided, the President has directed a temporal closure of the Nakonde border to facilitate interventions of high impact that will protect the people of Nakonde and the people of Zambia. This is timely. And remember that it is a decision that is informed by the state of the pandemic in Zambia and in the region, and all in the interest of making sure that trade, once it resumes, is done in a safe environment. You must protect the trade and commerce, and you can only do so by ensuring that there are no epidemics taking away the same people who are stakeholders in the market. So the temporary closure of the border will be surgical. It will involve measures that are going to be implemented in a multi-sectoral manner, in a swift manner, and very soon we'll get back to the public as to when the borders shall reopen. We also urge all stakeholders, transport owners, as the minister said, to cooperate. And it is easier to cooperate, but failure to cooperate will attract the wrath of the law. And our men and women in uniform are up to the task, as the minister has said. We further request the media to continue supporting the COVID-19 response by ensuring that we are professional and we do not engage in rumor mongering. We are partners, and let us work together. What is announced by the President should be taken for what it is, and what he has delegated to me to announce should be taken as what it is. We have no business playing around with numbers. We have no business not being transparent, because that does not add value in a public health response. So this is as it is, the cutoff point for the tests that are being done in Nakonde, being run through TDRC, and the validation that is being done in other laboratories is yet to come for the last batch. And therefore, we are saying we'll announce the total results tomorrow. So let us be patient. And we'd like to thank all the multi-sectoral workers, health workers, who have played a pivotal role in the response to COVID-19. Those workers and their families that have sacrificed to have those workers at the front line are applauded. We want to thank all stakeholders that have appreciated that COVID-19 is a very grave threat to the people of Zambia, and have held hands with government of President Edgar Chagulungu to ensure that we leverage resources for the response. The latest being the retirees from Bank of Zambia. Again, we express our profuse gratitude to the retirees from BOZ for the leadership that they have shown, the mentorship that they've shown to everybody else. We want to urge everyone never to stigmatize anybody with COVID. They should not stigmatize any social sectors, and ensure that we do not discriminate any of our brothers and sisters who are found with COVID-19. For the people of Nakonde, please support the intensified activities in the area and stay home and be safe, and ensure that you work with government to ensure that the response holds. No traffic into Nakonde, no traffic out of Nakonde. Measures have been adjusted based on the information that has been obtained about the pandemic in Zambia and in the region. And this statement has been made very clear from the word go, that His Excellency President Lungu will oversee a scalable, adaptable plan with measures being scaled up or scaled down depending on the information that we adduce as part of the epidemic as it evolves. So, 15 new cases in Lusaka, 1 in Chilanga, 3 in Chawama, 3 in Chipata compound, 3 within the catchment of Levi Manawasa, just nearly there, Ngombe 1, KK International Airport 3, that came through the Ethiopian Airlines. And through the routine screening at the investigating hospitals 2, our deaths remain at 7, COVID-related deaths, and our recoveries have increased by a number of 5 to 117 cases. We continue to quarantine people in Nakonde and to isolate them in designated facilities. Chinsali is the center where we are admitting patients, and other places in Nakonde. The elderly and the very young and those who are at higher risk at Chinsali, and the others who are more stable within Nakonde at designated facilities. Nakonde, from tomorrow, the President has directed a shutdown, and this has to do with all forms of traffic across the borders, rail or road. Thank you very much indeed.